Good morning and welcome to Let's Talk, Social Isolation and Depression. I'm Sharon Jagir, Manager of Community Relations and Marketing at B&H. Today I have Renee Pepin, PhD. She is a research scientist at the Dartmouth Centers for Health and Aging. She is trained in, excuse me if I say this wrong, geropsychology, and is interested in expanding access to mental health services for older adults in community-based settings. Her research consists of the implementation and dissemination of evidence-based depression treatments for older adults using innovative, brief, and practical strategies to delivery through a combination of community-based aging service providers and technology. Most recently, she has focused on feasible and engaging approaches to improving social connection among older adults. Welcome, Renee.
Thank you so much, and thank you for having me. I'm looking forward to talking about all things social connectedness, resilience, and well-being today. I have some slides that I'm going to share, and I also hope that this is interactive. So if people have questions, comments, thoughts, feel free to chat them in, and we can talk about them, and I'm going to rely on y'all for participation at some points in this. So I'm going to get started by just sharing some slides. Okay, I want to make sure I do this right. Okay. Get back to the beginning. Okay, so we're going to talk about social connectedness primarily. We're going to talk about the social context of aging, the social context of COVID, impact of low social connectedness. We'll talk a little bit about acceptance, and then we'll talk about restorative activities and things that we can do for self-care and to promote support. But to get started, I would love it if we could think about what are some of the aspects of social connectedness that we miss right now during the COVID pandemic. What are some of the things that we miss while we are observing COVID precautions? And I'm going to stop sharing my screen in hopes to see if there are any comments about that. So what are some things that we're missing right now? It might be getting together with people, music, singing with people, meals with people. There's all kinds of things, right, that we're missing. And so it's really helpful to get grounded in exactly what are you missing, or are the people that are around you missing. And this is important because everybody requires different things for feeling connected. So I think it's important to start with what makes you feel connected. So getting back to the slides. Okay, so keep that in mind. What are some aspects that you miss? So COVID, we're in it for the long haul. It's still going, and it's going to keep going. And so we want to maximize well-being, minimize fatigue, avoid burnout wherever possible. And this really requires a sustained effort to stay connected and keep an eye on our mental health. I want to get us grounded in some key definitions. So social isolation, loneliness, these kinds of things are terms that people kind of use interchangeably, and they do have some specific definitions, and I think that that's important. So social isolation is a lack of contact with other people, right? It's a limited number of contacts with other people. And loneliness is a feeling. Loneliness is a perception of social isolation. It's this feeling of being lonely. Social connectedness is like the umbrella of these things together. And one thing that it's important for us to remember is that there are people who are isolated who are not lonely. And there are people who are lonely who are not isolated, right? We all know people who have different levels of stimulation and interaction that's required to feel connected. So there are certain people who live in a remote area, they have very little contact with other people, and they're really happy about that. And then there are some people who live in really dynamic, vibrant communities or live with families, and they still feel lonely. So it's really important to keep that in mind, because we might just jump to, well, I shouldn't feel lonely because I'm surrounded by people all the time, and start getting kind of embarrassed or ashamed of feeling lonely. But really, everybody has different needs for the amount of connection that they require. I want to just touch on the social context of aging. So late life can be filled with a lot of changes, we know. And as we age, there's a lot of stuff that happens, and these things can impact socialization. And this is outside of COVID, right? We might have change in our functioning, might have changes in body and senses, like being able to hear. That really impacts communication and talking with other people. And that can impact our feelings of connection. Changes in living situation, right? You might be connected to a community and then you move, or your family members might move. You might have a big house. You might live in an urban environment, and you might change your living situation. A lot of times as we age, we have changes in finances. As we retire, our income might be limited, and that's often overlooked as an important component of socialization. But a lot of the times, the things that we do to connect with other people cost money. And then there's changes in social circles, right? Like I said, people move, they physically relocate, but also people die or people's functioning changes. So we're not able to engage with them in the ways that we might have wanted to engage with them before. So let's layer on COVID-19 with this. COVID-19 is really strange because it's temporary, but it's a long duration. And we're seeing people experience different waves of loneliness, of a lack of connection, feeling depressed or down or anxious, and they're coming in waves for people. So I work at the Aging Resource Center at Dartmouth. Last March, everything shut down and we put our programs online. And we got that done really quickly, and a whole bunch of people got online. And then we saw at the end of the summer, we had a new wave of people who were getting online. And these were people who in March and April said, I'm not going to bother with that. This is going to be gone soon. And so it's not going to be an issue. I'm not going to worry about getting online. But as the duration continued, they were more willing to try things. And it might be because they were more stressed by this long duration. Older adults, of course, are particularly at risk to poor outcomes associated with COVID-19. And COVID-19 has given us all kinds of interruptions in how we connect with people. Interruptions in social gatherings, interruptions in medical appointments, inability maybe to have services in the home or to visit services. And there are these really important cultural things that we do that are about getting together with people, like a funeral. And so when we're not able to do these cultural rituals in the way that we typically do, we can feel real lack of connection. And we know that loneliness and isolation are really actually pretty bad for our health. That's the take home, is that social isolation and loneliness are bad for our health. And you can see that there's all kinds of ways that that manifests, but it's bad for functioning. It's bad for It is associated with morbidity and mortality, so sickness, illness, and death. It's associated with risky behavior. It's associated with nursing home placement. So it's really important to pay attention to loneliness and isolation, which really travels very closely with depression and depressive symptoms, and to pay attention to these things because they really do have a health impact. So I'm going to just see if there are any questions or thoughts before I move on. Any thoughts, questions? Okay, so that's the stage of what's going on. Why does it impact older people more? COVID-19 or isolation? Isolation. So I would say that isolation doesn't necessarily impact older people more. Isolation is not worse for older people. It doesn't have worse effects for older people. But because of the context of aging, there are a whole bunch of things that happen as people age that make it more likely that they might be isolated or lonely. So the changes in physical functioning, sensory functioning, people dying that were very important to you, those things can make you more at risk of loneliness. So we've got a question about how we might know that people are isolated. So I'm going to say that isolation, that is the limited number of contacts, I'm less interested in. I'm not worried that people are isolated. I am worried about people feeling lonely. And I say that because there are people who are isolated, limited number of contacts, that they're okay with that. So it's really important to assess, and we're going to talk about connectedness. But we want to be honing in on a mismatch between the amount of contacts that somebody has and feeling satisfied by these contacts, right? So I'm a pretty introverted person. I don't need a lot of social stimulation to feel connected. I want to be connected to a few people kind of all the time. And so you would want to be asking me about the quality of the contacts and how supported, connected I feel, how lonely I feel, versus asking the number of contacts that I'm having, because that might not tell you much about how satisfied I am with that amount. Whereas, I work with one person in particular who she is like down if she's not talking to a bunch of people every single day. And so you really want to be getting into the sense of satisfaction rather than the number of contacts that somebody's having. And I would just ask about it. I would ask really directly. And I would normalize the fact that throughout the course of our lives, these things fluctuate. The amount of connection that we're experiencing fluctuates. That's normal. And that's something that I'd be pretty curious about, rather than, being judgy about somebody's situation, to choose to live an isolated life. Or again, I want to be really careful about people feeling guilty about feeling lonely when they are surrounded by other people. So let's talk about some things that we can do to help boost social connectedness and well-being. I'm going to share my slides again. Keep me on they'll keep me on task. Oh. Okay. So I want to say a word about acceptance, because acceptance is really important, particularly in the context of COVID. So acceptance means that we are acknowledging a reality and we're facing what's going on. We are accepting that we have less interaction with other people right now, and that that's not going to change tomorrow. Acceptance does not mean that you're resigning yourself to what's going on or you're quitting. And acceptance is not incompatible with making changes in your life. So it's really important to remember that acceptance doesn't mean this is okay. It just means it is. So I'm not happy with COVID precautions, limiting my ability to interact with other people, do things that I find rewarding and enjoyable, but I accept that this is the current situation. And by acknowledging that this is the current situation, then I'm in a position to decide what I want to do about it. I always say this, I don't know how we got the perception that social connection should be spontaneous and fun and should come really naturally. Social connections really actually take a lot of work. You've got to put work into relationships. You've got to put work into connecting with people. And we plan to get together with people. We don't always think about it. I think COVID-19 has helped us think more about it. I think that aging is another time where it might require planning as our lives change. It really needs to be sustained. We can't have one big event, one get together, one Zoom family meeting and feel like, okay, that's it. We're all connected. We're not lonely anymore. We have to continue to have these contacts in order to continue to feel like we're connected. And I keep bringing it back to, it has to be tailored to a person because different people need different amounts of social connectedness. So here are some things that I think we want to be thinking about. Building in restorative activities, support, and connection. Thinking about self-care. How do I support myself? What do I need to do to restore myself so that I have good well-being? And some of this might be related to relationships. What relationships do I need to engage in to feel supported? There's also community care. How are we supporting each other? Not only how do I support myself, but how do I support others? And for those that are in the workforce, how are we supporting each other in the workplace? So I'm going to stop sharing and just see, are there any thoughts about this? How do we support ourselves? How do we support other people? Okay. So we've got this in the Zoom chat about Zoom fatigue. So this is really interesting, right? Because people jump to, we need to Zoom. We need to Zoom in our professional lives. We need to Zoom in our private lives. We need to Zoom for our churches. We need to Zoom for community meetings. And it's Zoom, 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 Zoom. And Zoom is not always good for us. Too much screen time is not necessarily good for us. So I would say one step to overcome Zoom fatigue is to not assume Zoom is the answer for everything and not assume Zoom is the best way to connect with other people. We'll talk about some specific strategies that are not Zoom related, but I would not jump to Zoom. And then there's some basic tips if you are Zooming. So it's not just the Zoom that's a problem. It's sitting for a really long time. It's losing track of time, not getting up and eating and drinking, not being near natural light. There are all kinds of problems with kind of sitting oriented to a screen all day and all night that are problematic. But we want to keep it in mind. Step number one, keep Zoom fatigue in mind. And step number two, take a break from the Zoom. Don't always assume it's the right thing to do. Okay, here are some ideas. Practical tips and strategies for building in restorative activities, support, and connection. Check in with other people. Maybe it's Zoom, maybe it's not Zoom. Maybe it's texting, calling, sending an email, writing an actual letter, right? We want to be checking in with other people, and sometimes we want to be meeting up. That means synchronous. It doesn't necessarily mean face-to-face in the same physical space, but that's like at the same time, how are we together, whether it's email, whatever. And we need to continue to take alone time, right? So Zoom, another part of the Zoom fatigue, right, is being on the screen, being on and being present all the time. We need quiet time. It's going to vary person to person, but if you need quiet time, take that quiet time. Taking breaks. And then if there are things that are working, keep them going. Figure out how we make these things happen in this different environment. So if you always had a family meal on Thursdays, how can we make that happen even with COVID? It might mean that we're going to cook the same recipe in our different houses at the same time. And we might be on Zoom about that. We might never be on Zoom about that, but we're scheduling doing the same things at the same time, and we'll check in about them in whatever way meets the needs of the people involved. Give yourself permission. Give yourself permission to prioritize your wellness and then really make it a priority. Once you give yourself permission to engage in self-care and to connect to other people, make it happen. My biggest recommendation is schedule it and be very specific when you're scheduling it. What, when, where, and for how long. People ask, well, what are you going to do this weekend? Well, what I'm going to do this weekend is the same as every single weekend since COVID. It's kind of how it feels because we don't have as much structure in our lives as we used to. I think now it's even more important than ever to schedule things, because if we don't make it a priority and we don't commit to ourselves to do it, it often doesn't happen, right? And we want to make sure that if it's going to be an enjoyable activity, we're scheduling it at a time when we can actually enjoy it. Not that we're like cramming it in at the last minute to get it done because I said I'd do it. We want to do it in a way that we're going to be able to enjoy it. Set a timer, add a reminder, and if you can, get somebody else involved. Get somebody on board with your plan by telling them what your plan is. Maybe they'll do it with you. But even if you don't want to do this activity with them, having somebody else know what you plan to do does tend to help with follow through. So this gets back to the Zoom fatigue. Take breaks, get away from the screen, move your body, go outside, reach out for help, reach out to help others. So let's get back to this idea of what we can all be doing that we're not doing right now during the pandemic. So if you thought about an activity that you're unable to do, that brings you close to other people or makes you feel close to other people during COVID, maybe we can unpack why that activity is important to you and how we can get contact with that value, even if we can't do our normal activity. So I'm going to stop the share. And I can give examples, but if people have questions or their own examples, I think those are the most helpful. I have seen a lot of interest in the meal thing. So people are used to having a family meal with people outside of their home, right? And so this is a way that we connect with other people and we have connected with them in person. So like I said, I would consider, why is that event important? We get very tied to the event itself and not what it represents for us. So I would be thinking about, well, why is that important? That's important because that's a way for me to spend time with my family. I need to eat. I like eating. I like spending time with my family. And we share family recipes and we talk about our family history through recipes. Well, okay. So what are other ways that we can do that don't require us to be physically in the same space? I'm not saying that's not our preference, but we can't do our preference right now. So it might be that we want to pick a family recipe and that we want to all cook it this week, or we all are going to cook it on Thursday. And then we're going to text about how it went. An example from my life is that my sister-in-law, my husband and I, since COVID started, we have tried to, every single Saturday, we watch the same movie at the same time. We call each other on the phone, we count down to press play, and then we watch the movie separate in our separate houses, and we'll text while we're watching the movie. But after the movie's over, we call each other and we debrief on the movie. And it's not the same thing as watching a movie together. I'm not trying to suggest that it is the same, but it allows us to be together around this interest that we have. We get into this all or nothing kind of thinking. And so if I can't watch a movie in person with people, I'm not going to. Or if I can't watch a movie in the theater, then I'm just not going to do it. And I'm going to wait until I can do that again. But we're waiting for a long time, right? This has been going on for a long time. So I would suggest, if there are things that you like doing or ways that you like connecting with people, make that happen. Have done game night via Zoom. That sounds very interesting. I have not dabbled into games over Zoom, but that's really interesting. And I would suspect that that's the kind of thing that we might try right now while everybody's shut down, but that's going to be a way that we can connect with family members that live far away even later. Now, I'm going to actually, can I invite Sharon back in? Because I want to hear about this game night thing.
Hi.
Hi, tell us more.
So game night we did, it was, oh, what's that game? Apples to Apples. And so it was an online program, and I'd have to go and find it again, but it was fun. It was different. It kind of got a little bit hard, you know, everybody trying to talk at once. So you don't get those cues that you do being in the presence of someone, but it was fun. And a lot of my friends and I, we get together at least once a month and do games typically. So this was a nice way to connect when we couldn't do that in person.
Yeah, I think that, so there's one thing that we have sort of observed in our research. It's not like a hard and fast finding that we have thoroughly studied, but there is a boost that people tend to find in their well-being when they try things in new ways. So we have found in our research that when we compare in-person behavioral health interventions like talk therapy to those delivered over the computer actually works better. And that's not what anybody expects. And this is among homebound older adults. So everybody thinks that the preference is definitely going to be for in-person live communication. And we're finding better results across the board with that delivered by the computer, like virtual, like this. And we hypothesized, and we will test it someday. There's like a lot of things to test. But we hypothesized that that is probably because there's some added novelty, like it's interesting to try it over the computer. There might be some things that make it actually easier to engage, like you don't have to get in your car and go somewhere, so it's a little bit more accessible. But there's also what we call like the cool factor of I'm learning this new thing. I'm learning to interact in this new way. I'm developing new skills, and that adds this like extra little boost. And so I'm wondering about that in terms of the game night. Like there are some costs. It's not the same as doing the game in person, but is there like a little bit of this cool factor? Like I problem solved this. Right. I think that that's one aspect of our family movie night is this added boost of like, gotcha, COVID. We figured this thing out, and we're going to keep on doing what's important to us despite what's going on. So other thoughts, questions? Okay, so I just have one last thing to share other than if we want to chat more, talk about questions. But I want to talk about what you might want to do if you are really concerned about yourself or somebody else in terms of loneliness and depressive symptoms. So if you're really feeling like this is wearing on you and it's interfering with your ability to live your life, or you've been feeling lonely for a long time and it can't be explained by COVID, and even if it can, there are some things that you can do. So I have a slide to share on that, and this will be my last slide to share. Okay, so if you're feeling like this is going on a long time, it's interfering with your ability to live your life, there are things that you can do about that. So I would say, first and foremost, if there's a problem you can solve, solve it. If there's something going on that's making it so that it's hard for you to connect with other people or to do the things that are enjoyable to you, figure that out. If you need a hearing aid to be able to talk to people, figure out that solution first, because if we add in any of these other things, it's probably not going to have that much of a benefit. So solve a problem if you can solve a problem simply, but cognitive behavioral therapy with a counselor absolutely impacts not only feeling down, depressed, blue, anxious, but also pervasive feelings of lack of connection or loneliness. Mindfulness strategies help. Leverage technology where you can, but recognize that technology is not the answer to everything. And so if you are continuing to try technology and it's not helping, you're still not feeling connected, you're still not able to do the things that you like, you might want to talk to somebody about that. So there's cognitive behavioral therapy, mindfulness, support groups, and then people are doing really cool things in their communities to bring people together. And so you want to look and see what's happening, and you want to reach out to people who can help you navigate what might be happening in your town or in your region to help you get together with people. There's a lot going on. It can be hard to navigate it all yourself. And so it can be helpful to tune into some people who are kind of gatekeepers in your community, who have an idea of what is going on, what might be happening around you. It can be overwhelming to try to figure it all out yourself. So I'm going to end there, stop sharing, and invite Sharon back in.
Thank you so much, Renee. I think we have time for a few questions. How does loneliness lead to depression?
I don't know that we know that loneliness leads to depression, because we can see it working either way. So loneliness can contribute to a lack of connectedness, which could make us feel depressed. But also, depression can lead to loneliness, like withdrawal, right? And so I don't know that we're exactly sure how that works. But generally, the way that we think about depression, the way that I think about depression is depression makes it hard to do the things that are important to you. And so you kind of end up spiraling downwards because you feel down, you can't do the things that are important to you, and then you feel more down, and it gets even harder to do the things that are important to you. And social connectedness is really, or lack of connectedness really works similarly. So you're not getting the connectedness that you need. You feel down. It's harder to reach out to connect to people. You feel more down. You might be nervous, like some anxiety builds as you're not connecting to people. You lose that sense of like being cared for and cared about and belonging. That makes it even harder to get engaged. And I don't mean to suggest that one leads to the other. We just know that they kind of feed into each other, and that they seem pretty related.
Now, we've been talking about elderly people mostly, but we're seeing a lot of this in children, right? With remote schooling and not getting that connectedness that they need with their classmates. How can we help them?
I don't know about children. So certainly about parents, I get. What do you think?
Well, I think that I'm not sure, because it's been very hard, right, to have them connect. I've talked with many friends who say that their children are having anxiety about going back to school, being in front of peers again, giving those presentations that they might have to give. And I think as we can do more things, we need to somehow push our children to do that stuff. But it's also hard to make them do something too, right? So I'm not sure. I mean, I guess we could try to use the same things that we do for ourselves to make them feel connected to their friends, set up play dates online, those types of things.
Yeah. And I think so it's children, right? They require some level of social interaction for developmental purposes. And so we want to be paying attention to that. Also, what you're saying about promoting autonomy and independence when appropriate, but not letting that anxiety take over. And so I think that what you're saying about structuring things is great. And we see that across the board. Sometimes for people who are introverted or are kind of getting into the low social connectedness side of things, it can be really helpful to have somebody else structure some activities, some connection. The thing to remember about that is you want to be positive and hold the hope, but you don't want to be too positive, because you kind of lose your credibility if you seem a little too like silver lining and like, this is going to be great and it's all okay, right? You want to hold the hope. Like, I know that you can do this. We can totally do this, right? And have confidence and optimism, but not come on too strong with the positivity, because for people who are not feeling connected and for people who are feeling down, that can be... across the board, people don't love that. But certainly for people who are feeling down or people who aren't feeling connected, coming on really strong with the positive can be very invalidating. And it could make it seem like you're not a person to be trusted. So I just be careful about being overly optimistic and positive.
Wonderful. What are some risk factors that could trigger depression in seniors besides like being isolated or feeling lonely? Are there any other risk factors that could cause them to develop depression?
Really, really similar risk factors. Actually, the risk factors for isolation are very similar to the risk factors for depressive symptoms. So certainly health conditions, a change in people's ability to engage in the activities that are most important and rewarding for them, a change in health status, like functioning health status. Yeah, really, really similar. Changes in supports.
So how can someone tell the difference in a person that's feeling social isolation versus depression and get them the treatment that they might actually need?
Mm-hmm. Well, I would say that somebody probably could benefit from help in either situation. So I would not say that loneliness is not a problem that people should get help for, right? I would say someone who's experiencing loneliness could benefit from help. Somebody who is experiencing depression could benefit from help. So I would not, my question to you is kind of like, why does it matter? Why does it matter to for a person to kind of suss out whether it's loneliness or whether it's depression if the person is struggling?
Mm-hmm.
Because they might need help either way, and the strategies are actually really similar. The one thing I would emphasize is that people tend to in my research, we found that people are much more likely to seek help when it's framed for loneliness than when it's framed for depressive symptoms. So I'm kind of backing away from explaining these things that look really similar as depression, because it seems like a lot of people, particularly older people, can relate to the loneliness label a little bit easier than it is to relate or identify with the depression label. But I would say people can reach out for help for either of those things. And if it is truly lack of social connectedness with no depression on board, that depression might be right around the corner. So we would want to pay attention to it either way.
Wonderful.
Does that answer your question?
It does, yes. And just to end on, what exactly does the Dartmouth Centers for Health and Aging offer to older people? Yes.
So we have the Aging Resource Center, and we deliver all kinds of public programs. Right now, everything is virtual, which includes Zoom-based programs and also one-on-one phone calls. So we tried to get as many people up online as we could. We have Zoom practice space so you can practice using Zoom so you feel more comfortable in classes and experiences that are Zoom based. So you can practice the chat, you can practice the different video things, you can practice breakouts so that you don't have to practice those things while you're in a class when you want to be learning. We also have one-on-one tech coaching, which might be you're not up on Zoom, but you want to get up on Zoom. Our high school students will help you with that. And I think we have some college students right now too. And then all of our regular programs, which are focused on health and health in a broad way, mind, body, spirit, are being delivered by Zoom. So I teach mindfulness. I teach staying connected. We have support groups. We have classes about medication management kind of across the board. And then for people who are not online or who are online but prefer some one-on-one interaction as well, you can talk to Tammy, who does one-on-one phone calls from the Aging Resource Center. People love talking to her. She's wonderful. She's very kind. And it's just kind of chit-chatting with someone. And we also have a chaplain who offers one-on-one. We have a dementia resource specialist who offers one-on-ones over the phone or over a video, kind of like this. All kinds of stuff.
That's wonderful. Such a great resource to have in our community.
Yes, and I will say one nice thing about all of us going remote is that we're able to engage people who don't live right in Leb. Mm-hmm. And so we're able to get family members joining together. We've got people in more rural areas, certainly caregivers who it would be really hard to leave the home and leave their loved one who might require supervision to drive all the way to Lebanon, participate in a program, and then have to drive home. So not to be too positive, because I just said don't be too positive, but I do think that we're able to engage folks that, well, I know we are able to engage some folks that we were not engaging before.
Yeah, that's wonderful. Well, thank you so much for your time today, Renee. We really appreciate it. And as always, if anyone has any additional questions, feel free to email vnh@vnhcare.org and we will get those answered for you. Have a wonderful day.
Thank you so much.